Good afternoon. It's Dr. Ruddy. I want to discuss with you today in Morning Rounds a report just published in the Journal of the American Medical Association about 23 otherwise healthy servicemen who were diagnosed with myocarditis related to receiving an mRNA vaccine. So, first off, what's myocarditis? It's an inflammation of the muscle of the heart. I think the best way to understand this is to think about having been punched in the heart. That's what it's like. The symptoms are uniformly the immediate sudden onset of chest pain, as if you had just been punched in the heart. So 23 otherwise healthy, highly fit servicemen, all men, were reported to have developed myocarditis within 4 days of receiving an mRNA vaccine. And these 23 servicemen were diagnosed between January 1st and April 30th of 2021, so early this year. The report is a joint effort between Walter Reed and the Naval Medical Center in Bethesda, and they evaluated these 23 highly fit servicemen who presented with sudden onset of chest pain, and they worked very vigorously and thoroughly to try to understand why they had myocarditis. They did not have heart disease, they didn't have an infection, they had nothing except a recent mRNA vaccination. The authors point out something very interesting about this, and that is that myocarditis following vaccination is very rare, except in servicemen who've received a smallpox vaccine. I think that's very interesting. I'd like to have a discussion with a pathologist and follow up on what is it about the smallpox vaccine and these mRNA vaccines. Is there any relationship, or is this totally random correlation? In any case, highly unusual to have myocarditis following any vaccination, but now we have 23 in otherwise healthy servicemen reported earlier this year. The good news is that all of these men have survived this. Nobody has died. The majority of them have recovered completely. A few of them, as of this report, are still recovering. So a question would be, as it is with patients who've recovered from COVID, are there any longer term consequences to having myocarditis following mRNA vaccine? The authors also go to great lengths to, I think, reassure the public. I think they're writing to the public, quite frankly, to say that millions of vaccines have been given, millions of these mRNA vaccines have been given, that this is a highly unusual complication. They know for sure that in these 23 servicemen, it was the vaccine that produced the myocarditis. They don't know what it is about the vaccine that caused the myocarditis, but they're quite sure it was the vaccine because they looked for everything else and there was nothing else there. It was just they'd recently received an mRNA vaccine. They go to great lengths to point out that patients who get COVID frequently will have problems with their heart, particularly the older patients, and that the risk for myocarditis is low compared to the risk for complications related to the heart in patients who actually get COVID. And I think from a public health perspective and a policy perspective, that's a sound argument. I think probably the 23 men who developed myocarditis as a result of receiving the mRNA vaccine would not buy that as a good argument. I think they probably have more questions and would like to have a better understanding of why they got myocarditis. And I think we owe it to them to be able to answer that question. If we can't answer it today, certainly we can answer it sometime in the near future. We should set that as a question to be answered. Why did these men develop myocarditis related to the mRNA vaccines? What can be done to identify risk factors or screen for this or intervene early on so that even though this is an uncommon complication, we would like it to be well understood so that the risk of this happening can be reduced as much as possible. So that's it for today's morning rounds. Myocarditis in otherwise healthy servicemen. It did not appear during the early clinical trials with the mRNA vaccines as they were trying to develop approval status for emergency release, but that was because the size of the population that were being tested with these vaccines was relatively small. This is an unusual side effect. It was not likely to have been seen in the relatively small trials that were conducted in the pre-approval process for the mRNA vaccines. But here it is. It's a complication. Myocarditis is definitely related to the mRNA vaccines in men. Why men? Another good question. Let's figure that one out too. Until I see you next time, remember the two best medicines are love and mercy. And until then, God bless.